Hello everyone, my name is Jeannie Taylor. This is my second informative speech for CST 100, and this is my audience. My daughter Bria, Larry, Sharon, and Tuya as the camerawoman. I am doing my speech on eczema. Have you ever had a scaly rash that is so bad that wasn't relieved by applying lotion? How about seeing tiny blisters filled with clear fluid on your infant's face that involves severe itching? Or maybe a dry leathery patch on your arm associated with severe itching that if you scratched it, it would bleed. In most cases, you could have a case of eczema. My purpose today is to familiarize you with what is eczema, how it is diagnosed, signs and symptoms, and treatments that are available, and how to prevent eczema flare-ups. Eczema is also known as atopic dermatitis. According to the National Eczema Association Foundation, physicians estimate 65% eczema patients are diagnosed in their first year of life, and 90% encounter the disease before 5 years of age. Symptoms often diminish during childhood, though most will have atopic dermatitis for life. Atopic dermatitis affects 30 million Americans. There are other skins that fall into the category of eczema. It includes seborrheic dermatitis, nummular dermatitis, irritant contact dermatitis, and dihydrotic dermatitis, and allergic contact dermatitis. But AD is most severe and chronic, and I've done my research through Google Health, WebMD, MedicineNet, and National Eczema Association. My son was diagnosed with eczema at the age of 5 months. He was first treated with staph infection, yeast infection, and ringworm before he was diagnosed with eczema. He was prescribed with 1% hydrocortisone, Elidel, and Protopic, but that never helped relieve his symptoms. That's when his pediatrician referred him to a pediatric dermatologist. My son is now 3 years old and he still battles eczema. The first thing we need to know is what is eczema. It's a chronic skin disorder that involves scaly, itchy rashes. Most familiar is atopic dermatitis, which is chronic and long-term. Two ways. Now we will talk about the two ways that eczema can be diagnosed. It is diagnosed by a pediatrician, allergist, immunologist, dermatologist, or your primary care physician. Many people who have eczema also suffer from other allergies. Your doctor may perform allergy tests to rule out irritants or triggers. Now that you understand that what eczema is and how it can be diagnosed by different doctors, let's talk about signs and symptoms of eczema we see on the body. First sign is dry, reddened skin with intense itching or burning, blisters that are filled with clear fluid. If you scratch it, it may ooze and develop a crusty appearance. Rash can appear anywhere on the body, but mostly seen on the forehead, cheeks, forearms, legs, scalp, and neck. We will now identify treatments available, which are non-steroidal ointment, which is Protopic, or cream, which is Elidel. Those are used for long-term treatments. Antibiotics, antihistamine, prescription topical steroid ointment, or oral steroids. They're used in more severe cases, but used short-term treatment. Now that you know what kinds of treatments that are available for eczema, let's talk about how to prevent eczema flare-ups. There are lots of ways to prevent eczema flare-ups. Best defense is prevention, but flare-ups are rarely avoided. Cortisone creams used as directed by your physician. Avoid overbathing. Apply moisturizer frequently, especially after bathing. Avoid harsh soaps, detergents, and solvents. Avoid sweating, overheating, and sudden changes in temperature or humidity. Also avoid environmental and allergens that trigger allergies, such as pollen, mold, dust mites, animal dander, and food. Last but not least, managing your stress, nervousness, anxiety, and depression can help in some cases. I have here 2 visual aids. Not sure if you can see it, but this is my son at 6 months old. You could see red patches on his face. If the camera was more better, you could actually see blisters on his face. But that's him at 6 months. Eczema started on his face and his head, and now it's moving down towards his torso and his legs. And this is another visual aid. Oops. A picture I found on Google Health of a woman who has eczema on the back of her leg. Although there is no cure for eczema, we learned some things about the skin disease, and with the information that I have provided, you can now have a better understanding of what eczema is, how it's diagnosed, signs and symptoms, treatments that are available, and how to prevent eczema flare-ups. I hope with this information that I shared with you today about eczema that you keep in mind that eczema is not contagious. Being informed of eczema may help you determine if the itchy and dry rash that you have in the crease of your forearm might be a case of eczema. Thank you again, and this is Jeannie Taylor.